Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care.
Hello, everyone, and welcome to a very special edition of Pop Health Podcast. Today's edition is about the Health 2021 Boston, Massachusetts conference, where I had the opportunity to interview leaders at this conference that included over 7,000 people. This conference included CEOs of the vaccines for COVID from both Moderna and Pfizer, and other leaders like government, other entrepreneurs, health systems, just a variety of folks from all over the world. In the episode, you'll hear either part one or part two from entrepreneurs, some of the leaders of the biggest organizations in the world, and much more. We hope you enjoyed today's episode. Other episodes of Pop Health Podcasts can be found on our website, pophealthpodcast.com, our YouTube channel, Spotify, Apple Podcasts, or wherever you listen to your podcasts. Thanks, everyone. Enjoy the show.
All right. Well, folks, we have a very special guest with us today. We have Micky Tripathi, who is the National Coordinator for Health IT with the Department of Health and Human Services. Micky just finished a panel and probably had lots of folks wanting to talk to him afterwards. So really appreciate you making it over. Thanks so much for being here, Micky.
Sure. Happy to do it, Gavin.
All right. So you've been in the role since January, and we'll get into the role in just a moment. But before we do that, we like to get to know our guests a little bit. So maybe something outside of the IT world or healthcare world. What's a fun fact? I know you're a Red Sox fan. Any hobbies, anything like that?
Yeah, boy. I guess maybe I don't know if it's fun, but it's certainly weird. That this is actually my second tour in the federal government. My first was working in the Pentagon.
Okay.
Not even in healthcare. So I was a weapons system specialist doing cost analysis on weapon system programs, working with the Air Force at the time.
Yeah.
And then I moved over to the Secretary of Defense's office, where I became an expert in over-the-horizon warfare in Marine Corps weapon systems.
Wow.
Yeah.
So is that considered a military, like, are you working?
I was civilian.
Civilian, okay.
I was civilian, yeah.
Got it.
Yeah.
My whole family is, besides me, they were military guys.
Oh, okay. Yeah.
So the men, not my whole family, the men in my family served in the military.
Yeah,
So
yeah.
Really quickly on the weapon systems, anything cool in like 20 seconds you can say was like a cool weapon you analyzed? Or?
Well, yeah, and I spent a lot of my time working on the V-22, which is the tilt rotor Osprey. I'm sure you've seen it. You've seen it in video games.
Okay.
It's the aircraft that takes off and lands like a helicopter, but then it swivels forward and goes forward.
Okay.
Actually, we were, Dick Cheney was the secretary at the time, and we actually canceled that program. And I was the lead analyst on that particular program. And so
wow.
The secretary picked up my analysis, decided that we were going to cancel the program, and then it went back and forth with the Congress. As the Congress restored it, Department of Defense canceled it, did that about 5 times.
Okay.
And then they ended up restoring it because we have it in the force now.
Very cool. Well, thanks for the fun fact there.
Sure.
So can you tell us a little bit about the Office of the National Coordinator and what that means?
ONC, people refer to it as. Yeah, so we're responsible for coordinating health IT activities, both within the federal government as well as out in the market. And I know that's sort of a Pollyanna kind of, oh, you guys coordinate, great. But in particular, what that means is we work on and promulgate standards related to health information technology that are used by the federal government, as well as are required by different programs like CMS and CDC. Many of you the listeners, I'm sure, are familiar with the Meaningful Use Program. And the Meaningful Use Program, the ONC role in that was that we certified the electronic health record systems that providers were required to use in order to get the incentives that CMS gave to them. So we do the standards work, and we also certify EHR systems. So 95% of hospitals and over 90% of ambulatory providers in the country are using EHR systems that are certified by my office.
Yeah, which is great. And one thing that was interesting on this note, so like I shared earlier, Micky just came from a panel. I sat in and listened. And one of the things you started off with was, how's interoperability going? And I was expecting you to say horribly. But because for our audience, they get frustrated, right? So it's kind of like news. Like, there could be a lot of good things happening, but you only hear the bad stuff, right?
Yep.
And so I thought it was really interesting. You said, well, the good and bad, but good, and here's why. And one thing you mentioned was, in order for us to get to where we need to have EHRs to exist. That's the first step, right? Can you tell us about that?
Yeah, absolutely. So, often people say, oh, healthcare is so far behind. Oh my God, we haven't solved interoperability. And I just like to point out that it was 10 years ago that like 10% of providers of hospitals, for example, had electronic health records, and even lower number for ambulatory providers. And so, we literally couldn't have had interoperability before then. It's like saying, you want to have a phone network, except one problem: people don't have telephones.
That's what it was.
Right. So, so the first thing we needed to do is make sure that everyone had a telephone, and a telephone that could connect with other telephones, and then we build the networks on top of that. So that's that's kind of the the good news is that we've spent $40 billion plus as taxpayers, plus a whole bunch of private investment to get us to a point that now, as I said, over 90% of the provider organizations have electronic health records, and now we're building the networks. They're actually up and running to have interoperability across those systems to be able to share medical records.
Yeah, that is good news, and I wasn't expecting that answer, but it makes perfect sense once you explain it.
Yeah, we do a good job hiding that we've actually had some successes in interoperability.
Yeah, and speaking of success, so on this panel there were other folks, like many of you may be familiar with Unite Us, which is actually an investment of many different health systems coming together. Right? They have now 1,000 employees. I was shocked because they're kind of new, right? Yep. And they're talking about social determinants of health. We won't really get into that today. Well, maybe we'll at the end. But one thing you shared is it's an obligation, or if it's not already, it's going to be an obligation to share information. Not if you want to share it, but an obligation. Tell me tell our audience what you meant by that.
Sure. Yeah. So right now, and I'm sure most of your audience is familiar with HIPAA. They may not know all the details of it, but they're certainly familiar with it. And what HIPAA says is that organizations that are covered by HIPAA, like provider organizations, covered entities and business associates. So a hospital, an ambulatory provider, a pharmacy, a health insurer. Those are all covered entities in HIPAA language, and they're required to share. They're allowed to share information with each other without patient consent, as long as it's for what's called treatment, payment, or operations. So the key word there is permitted or allowed, but not required.
Yep.
And so one of the things that we've seen in the market is, well, they're allowed to do that, but too often they still don't do that for a variety of reasons. My personal view, there's a lot of people who, like to say that, well, that's because they don't want to share the information because they see it as a strategic weapon, and they're trying to block that information. My personal view is that it's more a question of priority.
Yeah.
Provider organizations, especially during the pandemic, they've got a lot of priorities doing God's work and other things, saving people, and a whole bunch of other things that's on their plate. And so, sharing information with others may not be the highest thing on their priority list. Now we have a new rule that comes from the 21st Century Cures Act that was passed in 2016 that actually says, that permission thing, now actually you're obligated to share the information with other parties. So what that says to provider organizations is you need to move that up in your priority list.
Yeah.
You need to get the technologies in place to be able to share that on, basically for every encounter with other authorized parties. So not just with anyone, but it's like with that other provider. You're a specialist, you need to provide the information back to the primary care. You're the hospital, you need to provide it to the primary care. You're the hospital, you need to share it with the patient.
Yes.
You can't tell the patient, oh, well, submit your form. Oh, you have to come in person, sign this form. Oh, it has to be notarized. Oh, now 3 weeks later, you're going to get the information. No, you have to make it available. If it's electronic, you have to make it available right away, just like you expect with your bank. No charge, as long as it's electronically available. Those are the requirements of this new rule that went into effect April 5th.
Okay, April 5th of 21?
This year.
Okay,
Yep.
Awesome.
Yep.
And so you were 3 months in at the time. So folks, Micky started the role January
20th. 1 minute past noon on January 20th, as the Constitution prescribes.
Okay, very good. So another thing you touched on, and I couldn't remember the exact wording, but I deal with this in my day job. I don't do podcasting full time. Is when your folks are trying to share information, they might have to fax it over.
Yep.
Right? Or
Yep.
mail it. My own doctors, right? Oh, we'll mail it to you in 2 weeks.
Right.
Huh?
Yeah.
Tell us what you guys are doing to combat that.
It's brutal. So, and it's part of the frustration that we have with interoperability. So as you were describing before, I think that there's a lot of good news about where we are with interoperability. These networks are actually up and running. It's the major EHR vendors. So for anyone who's out there using Epic, Cerner, Athena Health, NextGen, Allscripts, eClinicalWorks, all those vendors are actually parts of these networks that are connecting on the back end to share medical record information, and they do millions and millions of those shares every day. So that's the good news. The bad news is, to your point, that doesn't always get all the way down to the front line of the organization. So you still have the situation where you're a patient. Let's say you are going to go for a second opinion, right? And you want to be able to get your records and have them transferred. Literally in Boston, it would be across the street to another fine institution, right? And what they will almost certainly say to you is, what's the fax number? Or sign this paper form. And in the meantime, I'm sitting there. It's like, I know in the background, somewhere in this EHR system, you are able to send this information electronically, but they haven't done enough to push it all the way down to the last inch so that the frontline staff know that it's available, so that every part of the organization knows that your organization instinct should be push the button and send, not, oh, this fax is more convenient. And I think a whole bunch of that is about culture and is about training.
Yeah.
Because right now, that's in everyone's heads, right? They know faxes. They don't know anything else. One other quick story. My daughter is a doctor.
Okay. Locally?
Yeah, she's at Mass General now.
Okay.
But one of her experiences in going to Mass General was that, she thought the training on Epic was fine. She's like, fine. I understand that. She thought it was, like, why do we need a week for this training? I mean, I'm up and running in a half day. I don't see why I need a week. The thing she needed training on was the fax machine.
Yes.
They literally, at one point, she wanted to send some records to a community doc, and she's like, how do I do this? And they said, print it out and fax it. And she was like, how do I do that? And, oh, there's the fax machine. She's like, how do I do that? I've never seen one of those things in my life. So anyway, that's the current state, but we need to press hard to make the default be that you can't fax it anymore. You actually have to send it electronically.
Yeah, that's great. And one thing I meant to touch on earlier, you mentioned, private sector, government. I forget exactly what we're talking about, but Micky was on stage with big business, Google, Unite Us, and forgive me, Venture.
Health Reveal,
yep. Excuse me, and then the moderator was from Venture. What I've learned over government, what I see in person is government's not big and scary and out to get us, right? Like, you are asking for-profit commercial businesses to help you.
Yep.
Come to us. Tell us what we need to do.
Absolutely.
Right now, it's obviously there's more to it, but that's a general theme, and I've seen that in my own, world over the last few years. So, folks out there who are thinking the government is, putting up walls, that's not the intent. You're trying to tear those walls down.
Absolutely. Yeah. I mean, this can only happen with this kind of partnership, and so we do everything we can, from ONC to do that, and also, I spent 20 years in health IT before 1 minute past noon on January 20th, working in the private sector.
Yeah.
So I very much appreciate that, that the federal government can't figure this stuff out without the knowledge and the experience of the private sector and the willingness of the provider sector to actually do stuff, or the private sector to do stuff. Because at the end of the day, we can say all we want, but if the providers aren't going to do it, then, because you've imposed too much workflow on them, they can't treat patients better if you impose that, then it's not going to work at the end of the day either. So we've announced a number of collaborations, just collaborations where we have with the private sector embracing them to come in and work together on things like standards, as well as a whole bunch of other vehicles that we have to be able to get feedback. So contact us. We have tons of contact information on our website, micky.tripathi@hhs.gov. Email me directly. We'll get you to the right person.
And I am here. I reached out to Micky, I don't know, a week ago or so. And he responded, I don't know, within a few hours.
I actually look at my email.
Yeah, and we're just a small little podcast, but he's making himself available. He wants to get the word out, and when he gave that email address, which once again is
micky.tripathi@hhs.gov.
He's truly available, right? So take a listen, Yeah, listen to our podcast, of course, but take a look at Micky's profile and reach out. Definitely some cool things happening, and one of the reasons why I wanted to have on. So really quickly, you referenced the Cures Act, which I misheard as the CARES Act previously.
Right.
Maybe in like 30 seconds, can you explain what the CARES Act is?
Yep. Yeah. So the Cures Act is not the CARES Act. People do that all the time. Even in the government, people do that. So the Cures Act was passed in 2016, and I know that's just a date, but I will absolutely date it by saying that it was signed by President Obama. Whenever I say that, people are like, oh, whoa, okay, that was a long time ago. And the other thing I'm going to say will also date it. It was signed with incredible bipartisan support. So almost every member of the Congress actually passed the 21st Century Cures Act. So really, really strong support from both Democrats and Republicans at the time, signed by President Obama. And what it says is a couple of things. The first thing it says is that organizations are prevented or prohibited from interfering with the sharing of information with other authorized parties.
Yep.
And that patients in particular, but any authorized party, should have access, electronic access to their information via an API, which is like an interface, without special effort, was the exact quotes that were used, without special effort, and they should have access to all of their information, not just some little subset like your test results. So that's a really important statement, and that was what we were getting at before, the change from HIPAA to the requirement, the obligation that says you're required to make that information available. So that's one part of what it did. The other part is it said that ONC, my office, is responsible for establishing a nationwide network for the sharing of information. So I described before, these networks exist, but they're still not perfect. It's a little bit like, imagine AT&T and Verizon and T-Mobile, all great nationwide networks, but not perfectly connected, right? That would be a really weird world, right? If I had to, I want to call Gavin, but at first like, oh, are you on AT&T? No. Oh, now what am I going to do? Or, we can only text, but we can't call, right? That's a little bit of the weirdness we have today.
That's a great analogy.
Yeah. So that's what 21st Century Cures Act said to ONC.
Okay.
Figure that out.
Yeah.
Get those networks to get connected so we have seamless interoperability from a user perspective. And so that's the other thing that we're working on right now. That's going to go live in the first quarter of 2022.
Okay, and you're talking, when you say Q1, you mean like January through March?
January through March.
Yeah.
There's, why do we do it like that? Well, just to protect myself, but also because a big part of it is government clearance.
Yeah.
And I have no control over, what's that clearance process look like? What does OMB say? Are they going to weigh in? Are they going to say, no, that's fine? Or are they going to say, oh, we have a lot of things to consider here, and then that slows the process down. So I don't want to, sort of oversell something when I don't have control over it.
Totally get it. Makes sense. Okay, so as we wrap up, two more things I wanted to touch on.
Sure.
Where was I here? Minimal viable compliance trap. Explain in a nutshell what that is. Minimal. Maybe you repeat.
Sure, absolutely.
You can say
yeah. So what I mean by minimum viable compliance is that we'll put out a regulation, and again, many of your audience will be familiar with meaningful use, and who knows, maybe they were involved in implementing minimal viable compliance. But the idea of minimal viable compliance is, there were a whole bunch of rules, let's say, or regulations where we said, all right, providers are required to use these EHR systems, and they're certified. And then meaningful use came along and said, and you're required to share information with patients through this. And then, and then you get at this question of, well, what does share mean, and how much am I supposed to share? And then so you start to have thresholds, and then you start to say, well, okay, so you have to do it with 25% of your patients, let's say. And so then what happens is organizations will say, okay, I'll share it with 25% of my patients, and now I'm done.
Yep.
And it's like, well, but come on. It's like, that wasn't the spirit of what this is. You're supposed to be doing it with all your patients, right?
Yeah.
And that's what I mean by minimum viable compliance. We had too many situations. We had another standard, and I'll just touch on it briefly. It was called direct, which was basically an ability to email securely one provider to another. So instead of the fax, right?
Yeah.
Instead of being able to say, well, wait a minute, you're leaving the hospital. I know that the records want to go to your primary care physician. Instead of faxing them, I can just send them via secure email.
Yep.
Well, we implemented an approach, a standard for being able to do that. And then what ended up happening was that everyone started focusing on, well, what am I required to do with that? Oh, I'm just required to do this, which is a transition of care. Well, okay, I'm not going to make it available for that or that or that or that. And also, because I don't really like that, I'm going to bury it in the basement of my software so that no one can really find it, or they'll have a really hard time finding it. That's what I mean by minimum viable compliance. Yeah,
well, luckily, as you mentioned, it's going to be an obligation to share information and do it in the near future.
Yep.
Lastly, just super briefly, SDOH, Social Determinants of Health, you guys are working on measuring or having it tracked, but it's early stage, right?
Yeah, so what we do is we have a data set that we call the US Core Data for Interoperability, which is like the minimum data set that's required to be supported by all EHR systems for the purposes of sharing.
Yeah.
Just so, if someone wanted your record, they ought to have some sense of, okay, here's what I'm going to get, and that'll give me a pretty good sense of what's going on with Gavin. Maybe there's more information to get if you have something complicated, but that's pretty good baseline information. So what we do is we add more data elements every year as standards develop, and as we sort of see different things that that are important in industry. In July, what we did is we added 5 social determinants of health data elements to that required data, and sexual orientation and gender identity data that's now required to be made available. Social determinants of health data is still very new. It's very nascent. So what that does is it's a set of guidelines right now. But over the next year, we're going to be working with the standards community to say, how do we make those hard and fast standardized data elements that will then say are required to be made available in the HR systems.
Awesome. Folks, I can do this for another 90 plus minutes with Micky.
Me too.
And maybe down the road we'll work with his team to see if we can do a full episode. But Micky Tripathi, who is the National Coordinator for Health IT for the Department of Health and Human Services, has stopped by. Micky, thank you so much for being part of Health and our podcast today.
Great. Thanks so much, Gavin. Really enjoyed it.
You're welcome. Take care.
All right. Take care.
All right, folks, so I wasn't planning on this guest when I first came here in Boston, but had the opportunity to have lunch the other day, and I sat next to Peter Schlecht. I don't know, Peter, help me with your last name.
Peter Schlecht.
Thank you very much. And the audience, most of our audience, Peter, is domestic here in the United States. Some of you may have picked up on Peter's, if you don't mind me saying, accent. Peter is from Germany. And give us a little background before we jump into your organization, Peter. You are the founder of Braingrade, so we'll talk about that. But tell us where you grew up and how you eventually ended up at Braingrade.
Sure. So I grew up in Würzburg. It's a small town in the middle of Germany, what should be famous for the first Nobel Prize.
Okay.
X-rays went to Würzburg. It wants to be famous for wine, but it's actually not. And then I studied economics and informatics. I built up my first company, so I soon wanted to be an entrepreneur. Typical reasons, kind of getting recognized by the father.
Okay.
And then I built a company for natural language processing and natural language generation for customer success and sales.
Okay.
So, to say it in easy words, email autocomplete.
Okay.
And sold the company and had some freedom and to think about what to do next.
Wow. How old were you when you sold the company?
I was about 31.
Wow. Good for you. Yeah. This is really cool. So you mentioned your father, and you wanted to make your proud, right? I'm assuming that did the trick?
Yes, but then you realize that your father is whatever you're doing is proud of you.
Yes.
And so kind of this, your motivation goes down, and then you ask yourself, what do you want to do with the rest of your life?
Yeah.
And the deepest thought that I found for myself is kind of the same. I think that every entrepreneur has is kind of starting with, I want to make the world a better place. And then you have to ask yourself, okay, how am I going to do that? And for me, that was the thought, if we can improve our most important tool, what's obviously our brain, then we increase significantly the chance of solving all these problems and challenges in this world.
Yeah.
And driven by this thought, actually at this point, something else happened. Alzheimer's struck my family, and I saw that this is actually very much aligned, as these are the people who have the biggest need for help with their memory, with their brain. And so the journey began.
Yeah, so that's great to hear. And it's neat to hear your personal connection. One of the reasons, besides your cool accent, and I knew you're probably from Europe, and I love soccer, so we talked a little Bayern Munich a little bit, but I'm older than Peter, so I was naming some names. He's like, yeah, I was a little kid. He didn't actually say that, but I was naming some names, and he was probably a young man while I was well into my adulthood. But one of the things that really connected with me is, for audience, some of you may recall this, but my dad, I think I shared this with you, Peter, he was 70, had rapid stage dementia, and he eventually passed away. So when you were talking about...
Sorry to hear that.
Oh, thank you. It's been a long time, and he's in a better place. Thank you very much. So when you were telling me the story, I'm like, oh, personally, I'm interested in hearing more. But as you started to talk about it, I know my audience and our audience of the show work in healthcare, of course. Many of them work with patients who have dementia. Many work in senior living or home care. And so you're talking about this chip. And so your company's name is Braingrade. Before we get into what it is, how did you come up with the name Braingrade?
It wasn't actually myself. who came up with the name, but the idea is an upgrade for the brain.
Okay. Okay, so let's go ahead and talk about it. What is this upgrade you're talking about?
So the upgrade I am talking about, and this is in the first place a medical device for Alzheimer patients, is a neurostimulator, so a brain implant that is helping Alzheimer patients. So it's giving them a bump in memory, and it also helps them in decreasing their decline of the disease. But when I'm saying that, I have to add, we are an early stage company, so we are building the device in the moment.
Yeah, so this is all like, I mean, if this comes to fruition, I know when we were having lunch, you mentioned about 2 years is your vision of when this becomes a reality. Is that correct?
Yes, that's correct. A little bit longer. So but when really the company kicked off, as I told you, I have the background of economics and informatics. I had a lot of things to catch up, and this nearly took me a year. And I'm not at the level where kind of from a neuroscience standpoint, but then you learn kind of how much factors are going into such a device, and it's like from the chip to the electrodes to the system design to for sure the neuroscience, but it's also, and you mentioned your audience, it's how healthcare professionals should handle the device. So I mean, it's fully implanted, but still it needs to be charged, and to listen to them and learn how they interact with that. That was very important from us, and kind of not only kind of from the patient's view, but we, both of us, unfortunately learned that Alzheimer's is also a disease that is not hitting only the patient, it's also hitting the environment, it's hitting the families. So we have to understand this, we have to understand from the neurosurgeon standpoint. And yeah, I'm blessed kind of with all the conversation we can have as a team with all these different stakeholders in these disease.
Yeah, so folks, one thing you probably just picked up on is, like, if you guys want to reach out to Peter and give input or ideas, he's all ears, right? Like, he's got the idea, he's got the team. I know you guys are headquartered in Austin, Texas. I'm trying to encourage Peter to go see Austin FC, and I'm guessing most of the audience has no idea what I'm talking about. It's Austin Football Club, which is a soccer team, folks, not an American football team. So that's your headquarters. But yeah, how do folks, I know we're not done yet, but how do folks reach out to you, Peter, to give input or share ideas? What's the best way to do so?
The easiest way, or the two easiest way, is either via email. It's very easy, ps@braingrade.io, or feel also free to reach out to me via LinkedIn.
Awesome. In English or German?
You're free to choose.
Okay. Got it. I ran into a guy the other day who speaks 6 languages, but English and German only, right?
Yeah, it's a little bit of this French. This is but more homeopathic from school, and then there's my kind of third or fourth language, that's Denglish, so it's then the combination of both.
Yeah, nice, awesome, cool. So the goal is in a couple of years, maybe more, that there is this chip. Is that this? I mean, what would you?
I would call it like many people are most likely more familiar with a deep brain stimulation device, what Parkinson patients get, kind of to control their tremors. And this is actually the extension for it, or like the one development step further. Because we have to make clear these deep brain stimulators are 20 years old technology.
Okay.
And in our eyes, it makes no sense at all that you have specialized medical devices for your heart, for your hearing, kind of to improve with cochlear implants, but for Parkinson, but you don't have any specialized device for Alzheimer's.
Yep.
Especially as we learned, unfortunately, that drugs don't seem to be the solution, and kind of drugs trials in Alzheimer's, this is unfortunately a big graveyard. Only 1% have somehow positive outcomes. But when you look into bioelectronic trials, you have more like 88% positive outcomes. So we have a clear hint, and we see in the science that we can help the patients with such a device.
Wow, I did not. I did not realize that there's already indicators of success with these devices.
Oh, yeah.
Okay.
There's also already these deep brain stimulators are available for Alzheimer patients.
Okay.
But these devices have been created for exactly the opposite. They have been created for stopping an over-synchronization in the brain and kind of to reduce brain activity, while we need a device kind of what enhances the brain.
Yeah.
And what helps with the synchrony in your memory circuit. So this is kind of what we are building, and not kind of implanting a cochlear implant to help then with Alzheimer's. It makes no.
So that's great. So it's still a ways out, right? But let's say it works. 2-3 years, we're going.
It will work.
Yeah. Wow, look at that. It will work, folks. All right. Are you taking investors?
We are taking investors. Thank you very much for asking. Can I repeat my email and my LinkedIn? You can.
At the end, definitely. Yeah. 2-3 years, it will work. 5 years from now, where do you anticipate? Assuming you're telling the truth, it works. So after a couple of years being up and running, where do you think it'll be? Will it be across the United States, across the world? Will it have to start small? Tell us about that.
So in 5 years, we will be on the market. So everyone can buy it. That's the idea and that's the timeline. So we are done with our trials and everyone can purchase it, and we hopefully can help as many patients as possible. So our first go-to-market kind of is a combination of the US, as we are based in the US. We are doing our first trials in the US, thanks also to the FDA. I think maybe I don't hear this too often, but kind of for the guidance and for the support. And then we also will get CE mark in Europe, and the goal is to help as many patients as possible. So kind of the US and the European Union is the obvious choice for us.
Awesome, Peter. Well, hey, really appreciate you coming by to give a little bit of overview about Braingrade. I know it was short notice last couple of days, but we were able to make it work. I know you want to be able to put out your contact information. I'm happy to give you guys another opportunity there. So, Peter, how can folks reach out to you?
Yes. The easiest way, email ps@braingrade.io or LinkedIn. Thank you very much, Gavin, for the invitation. And as I mentioned, we are interested to speak to all stakeholders. So we are interested to speak to the caregivers. We are kind of to patients. We are interested to Alzheimer key opinion leader. So they really should look at our science, because we are very confident that it will work, but we want to be sure that there are no gaps and we really can help Alzheimer patients, and for sure also investors are welcome.
Awesome. So I'm going to put a note in my calendar from 3 years from now to listen to this episode again and hear Peter say, it will work. And then I'll reach out to you and see what kind of impact you guys are making.
And we see us again.
Yes, that'll be great. Hopefully you won't be too busy by then with all the worldwide success you're having. So again,
thank you.
You're welcome. Peter, give me your last name one more time.
Peter Schlecht.
I am half German, but I can't pronounce it. My parents will be upset.
Super fine. It's the funny nowadays, I have to tell you, it's the translation is Peter Bad.
Oh,
so I hope it's no omen.
That is totally fine. Thank you, Peter, very much. Again, folks, Peter, who has helped found Braingrade, and again, you can reach out to him, ps@braingrade.io. Thank you very much, Peter.
Perfect. Thank you very much.
All right, folks, so we have Krish Ramakrishnan with us today. Did I say that correctly, Krish? Ramakrishnan. I'm just one letter off. I'm sorry. I said it right the first time off the air. Sorry about that. And Krish is the co-founder of BlueJeans by Verizon, but when you guys first got started, you weren't BlueJeans by Verizon, correct?
We were just BlueJeans.
Yes.
As the company.
Very good. So before we get into BlueJeans, I'd like to get to know you a little bit, Krish. We were talking off the air about sports. Where do your sports allegiances lie?
Well, I like the Warriors. I live in the Bay Area. I like the Warriors, and I like their chances this year. And on the baseball side, I like New York Yankees. Always been a Yankee fan. So that's where we are.
Well, folks, we are actually recording in Boston, and fortunately we're surrounded by soundproof barriers, so the Boston Red Sox fans will not hear that. A colleague of Krishna, Aaron, who helped put this together, I know her husband is a Boston Red Sox fan. They're actually playing right down the street, so just be careful what you say there. Okay, cool. So tell us a little bit about the inspiration behind BlueJeans.
When we started the company 10, 11 years ago, it was really about how to democratize video conferencing. At that time, back in the days, video conferencing was a very expensive value proposition for a lot of companies. They had to spend upwards of $100,000 to $200,000 per conference room to set up video. So we questioned that value proposition and said, why cannot we have something that everybody can use in a company and make it also a cloud service, universally accessible? And that's the inspiration behind the product. And we named it BlueJeans because of that, because we wanted something that has a universal appeal.
Yeah, awesome. Cool. I brought some BlueJeans with me. I know what you mean. Okay. So was it pretty, I know you're the co-founder, so who's kind of with you supporting BlueJeans at the beginning?
Right, I have a co-founder named Alagu Perianan who we used to work at Apple and other companies like that. And we partnered together and we said, let's do something really different. And you know what? Both of us did not know anything about video conferencing. That made it fun, and that made it challenging, and that made it worthwhile.
Nice.
Something like innovation.
Yeah, and so I know you got some funding, and I know you're a Yankees fan. There's a connection there from what I recall.
Right. So we had a lot of the venture funding, traditional venture funding from Silicon Valley, who's who. In addition to that, midway, I was able to get one of my great Yankee favorite, Derek Jeter, to invest. As you know, as he was retiring from the New York Yankees and he wanted to do something to do, he was looking at how video will play a major role in communication for athletes. And as part of looking at the Players Tribune, which he's the founder of, he said, I want to be able to use video conferencing for that. And so through our mutual connection, we were able to meet, and he flew out to California, looked at BlueJeans and said, I want to invest.
All right, awesome.
And so he invested in the company, did many customer calls for me, and been a great supporter.
Great, and then ultimately Verizon got involved. Tell us about that.
Well, the pandemic is a great accelerator of things. I mean, one of the things it did was turbocharge the use of video conferencing. As you all know, everybody had to use video conferencing, and we, as BlueJeans, always sold into big enterprises, the big companies out there. And Verizon was looking into this space during the pandemic and said, we need video. After all, is a communication. Verizon is a quintessential communication company. So they said, we need to have this technology and take it to the next level. So that's how the partnership happened. The neat thing about this is the medium of video conferencing was used to make the M&A transaction happen.
Yeah.
Such a transaction of such magnitude, for the first time being done over video conferencing without having to meet lawyers, bankers, everybody else over months. And that in itself proved to Verizon that it's actually a worthwhile medium to do all sorts of business.
Okay, so tell us a little bit about BlueJeans. I think folks listening, we're all familiar with Zoom now. So when I think of video conferencing, right, that's kind of something that I think I can share. What's different, or what's the use case that's different than when people think of like traditional video conferencing?
Well, at a surface, BlueJeans is similar to Zoom in terms of its meetings capabilities, large events capabilities, conference room capabilities. We are there.
Okay.
Beyond that, BlueJeans focuses on business customers and enterprise customers cater to their needs, and which is different than what a small business or consumer would focus on with other products. So that's one difference. So we cater to that. So what do enterprises and business need? They need security. They need privacy. They need encryption. They need analytics to know who is talking, when they are talking. All of those things, we provide that in droves. One of the differences. And just the focus on enterprises and how to sell them and integration one of the things that enterprises have is a bit of everything. They may have products from Microsoft, they may have products from Google, they may have products from Cisco.
Yeah.
One of the things that we do well is interoperability. We make all those systems work well together with our service. So enterprises need that homogeneity in terms of how they want to use their services. We provide interoperability and great end user experience for their users.
Okay, so let's talk about how BlueJeans is working with the healthcare world. Tell us about that.
Yeah, reason we are here. One of the observations we have made is televisit is here to stay. Right? It got its boom during the pandemic, but what people have found out is there's a lot of convenience for television. The thing that was missing though, during the pandemic, everybody used their favorite video conferencing tool, which was not designed for televisions.
Right.
It was designed just for meetings. But Gavin, you and I know a meeting between a patient and a doctor is not a meeting, it's an appointment.
Yeah.
There's a workflow that is different. So what we did was take the BlueJeans video technology and purpose-built a telehealth application for telehealth, televisit itself. So some of the differences would be things you would notice would be, hey, I don't need to download an app. I just get a link from my provider, say, hey, I have a 3 o'clock doctor's appointment. I click on the link and a video will show up.
Yeah.
That'll be simple because many of the people are not good with technology, especially our senior citizens.
Oh, yeah.
Right? And they may not have the latest phone.
I have to say, I hated having to download apps, especially during the pandemic,
You're right.
to talk to somebody. It was frustrating.
Right. So this way, somebody will click a link and the video will appear reliable. It's Verizon, it's 5G. All those things work well. The second, if you notice, if you go into a regular clinic, not you just directly, you walk in, you meet a doctor. You actually go into a lobby, a waiting room, you meet, you do fill out some intake forms, and then the doctor reviews your intake form, and then they come into the appointment.
Right.
Right? We had to recreate that experience in a virtual way, right? So when you join a BlueJeans meeting, you go into a waiting room where if the doctor wants you to fill out an electronic intake form, what's your condition, fever, whatever, you'll be able to say all those things. And there'll be other things you can do in the waiting room, like watch videos, read articles that pertain to all those things are popular in the waiting room. There you can review while you're waiting for the doctor to come in. And at the same time, you can also upload all of your healthcare data. Let's say you're wearing an Apple Watch. A lot of people do.
Yeah.
Wouldn't it be great that during your visit, with your permission, that Apple healthcare data is uploaded and visible to the doctor, right? That's one of the reasons people always went to the clinic is because they need their blood pressure checked or a temperature checked or oxygen checked. What if we can just do all that?
Yeah.
It changes the whole game completely. And so we have done that. So those are some of the differences, especially with what we have done with healthcare.
Okay. So who are some of your partners making this happen? You mentioned like the Apple Watch.
Right. So BlueJeans completely did this, and we partnered with Apple for integration. We also partnered with health record organization, the EHR that they call, Epic is one of them.
Okay.
So Epic, we integrate with them. So that's the back-end system that hospitals use for maintaining their electronic health record.
Yeah, I'm sure many of our listeners are definitely users of that.
Right.
Yeah.
So we seamlessly integrate with that. And we are also integrating with other EHR providers. We're not just limited to Epic, which started with that. There'll be integration with Cerner, the second one, and then will be a host of myriad of other providers out there.
Got it. So while our show is intended for healthcare professionals, we do get the public listening in, from time to time. So the public, like a general consumer of healthcare, may not know that their video software that they're talking to the doctor is a BlueJeans product, and they won't have to pay for it, right? Your customer is the health system, the doctors, the insurance companies. Am I understanding that correctly?
Right.
Okay.
So the consumer is not going to pay for the service. The healthcare provider would provide a link, and it's they are the ones paying for it. One of the things that I forgot to mention from the consumer side, one of the uniqueness is we all also integrated a interpreter service, live interpreter service into this video interaction, similar to what would happen if you were to visit a clinic and you need a translator.
Yep.
Many hospitals have translation services that they contract out with. So we have directly integrated that into the offering. So when you join and you say, hey, I need one of 100 languages, we can pick on, and live interpreter would come in.
That is huge. And if you're not already, I encourage you to lead that as a headline you're probably already doing it with a lot of your meetings, but disparity is a major issue, right?
Yeah.
And cultural issues.
Yes.
So that is awesome. And so folks, in case you missed it, if you weren't listening over the last 30 seconds, the ability to have live translation services built in to this system, I mean, I don't know if anybody else does it. It's pretty dang neat, and it's a hot topic right now. Yeah. So that's really cool.
It's live interpretation and live translation, both. So translation is more text, speech to text. Interpretation is a medical grade interpreter that the hospital have. They will come in live and translate in real time.
Thank you for clarifying. That was helpful. Very good. So if folks who are listening are like, hey, the service that we currently have, or we're looking into a service, and they want to look into BlueJeans as a potential offering for their health system, what do they do today? Just Google BlueJeans, or how do they learn more?
Well, they can Google BlueJeans.com or come to Verizon.com and get to BlueJeans telehealth services.
All right, awesome. And Krish, are you active on social media? If people kind of want to follow the company or follow you, what's the best way to do so?
I'm active on LinkedIn.
Okay.
So that's where my profile is, and that's where they can follow me on.
Awesome. Now, I am able to spell your name because I wrote it down, but can you spell it for the audience one more time so they can follow you?
Krish, K-R-I-S-H, Ramakrishnan, R-A-M-A-K-R-I-S-H-N-A-N.
Very good. Well, folks, Krish has been our guest. He's the co-founder of BlueJeans, and I wish you and your team great success, and we'll look forward to seeing what you guys do in the near future. Thanks so much, Krish.
Thanks, Kevin. Thanks for having me.
All right, take care. All right, well, Amy is back from Fitbit. Great to see you again, Amy.
So great to be here. So much has happened in the last couple of years, so it's nice to be back in real life. Thanks for having me.
Absolutely. So for those of you that have been listening to the podcast for a while, you might recall at the health conference in 2019, Amy joined us for an episode we recorded from Las Vegas. And at the time, there were power outages in Northern California, where you were from. I think you mentioned you guys were your kids were camping out, or your husband, or do you remember that?
I do.
Yeah.
I was I think I had either just come off the stage or just was about to go on the stage, and I got this call from my husband that my family and my house was being evacuated because there was danger from wildfires. And so right before I'm getting on stage, I'm calling my husband and saying, don't forget the dog and the passports and everything else, something that we didn't think we'd have to deal with. But happy to say that, they were able to contain that pretty quickly. And though there's been devastating wildfires since then, knock on wood, as far as I know, all safe at home.
Very good. Well, this might not make the show, but there was another power outage in San Francisco with the Giants recently. And I'm a Dodger fan, so I don't know if this is safe.
Oh,
is this
I'm sorry
safe,
to
Amy?
hear that. I am from Boston, though, so okay. Red Sox, there's a big game tonight, so
yes.
We'll focus on that one.
All right, sounds good. Yeah, folks, we're, as we mentioned earlier, we are here in Boston. Fenway Park's only a couple miles away from us, and they're playing the Astros tonight. By the time you hear this, you'll know the results. So let's jump into Fitbit in just a second, but last time we got to know you, we know you were a weekend warrior, but tell us something about you that's outside of the workplace, a fun fact, something about you.
A fun fact, wow. Well, one thing that I find interesting and has actually become a pandemic habit is that my husband was a former professional tennis player. And I played tennis loosely in high school. So we've picked that back up during the pandemic, but he has to play with his left hand. He's right-handed. And so with that, we can have a little bit of a competitive game, and I think he still takes it easy on me. So I've now become a tennis person, and in particular, I really love cardio tennis.
Cardio tennis, tell us about that.
Well, what isn't better when you put it to great music, right? So it's kind of a cardio workout with a tennis racket and with great music in the background. So kind of brings all the things together.
Are you actually hitting the ball?
You are hitting the ball. There's a coach, and they are firing rapid fire balls at you, but they're making sure that you're getting your cardio workout at the same time. So it's really fun. About 4 to 6 people max. So you can imagine you're kind of rotating through stations and different types of shots. So you get your tennis in, but you also get a really great workout.
And are you wearing your Fitbit during this?
Absolutely. In fact, my tennis instructor now stops and asks me, like, how's the heart rate throughout it to try to make sure that we're all getting that workout.
Awesome. Cool. So let's jump into Fitbit. So when we were chatting a couple years ago, you probably knew, but I didn't, what was happening behind the scenes with the Google acquisition. When Google acquired Fitbit, to be upfront, I was like, oh, Amy may no longer be there in my head. I was like, but you're here. So tell us about that acquisition and how it's gone so far.
Well, I'm thrilled to say I'm still here, first of all. It's been a really exciting 2 years, very unusual in more ways than one. You can imagine with a pandemic and an acquisition. But I'm here to say that it's been really terrific. What we had hoped for is that we are able to continue to further our mission, which is all about helping people live healthier lives, to be able to do that with impact and at scale. And so I think with Google now and the backing of Google and all of the other great things that Google's doing in health, we now have the opportunity to really continue to innovate on that vision and that mission. So really excited to say that I'm still here and that our team is really continuing to further the great work that we're doing.
Awesome, cool. So back in 2019, I think I had just bought my wife the Versa 2 or was about to get the Versa 2. She still has it, and no, Fitbit did not send me any free products, but she is still wearing hers. So
thank you for being part of the Fitbit family.
Absolutely. We're not premium members though. Tell us what premium is.
Absolutely. So our premium membership is almost about that length of time, about 18 months or almost 2 years old. And really what it is to help you extend and get the most out of your Fitbit experience. So it really takes extra insights into your health and well-being, so kind of personalized insights, trends over time around your personal health metrics. And then it also provides workouts, so from 10 minute to 60 minutes to full body to stretching exercises, and then also mindfulness. And that's one of the ones that I'm using now every day. That was another thing when when COVID-19 and the pandemic hit, I started a mindfulness practice because the mental health effects are real and will be lasting. And so that was a really important piece to me. So having even 5, 10, 15-minute sessions, morning, evening, for stress, for all sorts of things, and even mindful eating, and bringing all those things together in a single package for Fitbit users who really are looking to kind of increase their experience with Fitbit and make sure that they're reaching their goals even faster.
Okay, cool. And what does that cost if someone wanted to do a premium package?
Yeah, it's $79.99 a year.
Okay.
And then there's also a monthly membership, so you can try it out. And all members have access to a couple-month trial to be able to start that out first and really experience it firsthand and what it can do to kind of amplify your Fitbit experience.
Okay, cool. So there's other wearables out there. For our healthcare audience, what would you say is different and what should be important for them to know about Fitbit versus other wearables?
Sure. So, of course, I've been with Fitbit for a long time, and we were the first and kind of the innovators in this space. So I think that what's important about us now is that our mission has really never changed, and it continues to be really important to what differentiates us in the category, which is this focus on health. So it's really a health first and a holistic health story. So it's activity, sleep, nutrition, and mindfulness, and how they all work together, or sometimes they don't, and that's the problem. But looking at that data in context, and then providing those tools like the premium membership that we mentioned, or trends and insights to help you further reach those goals, is really what's unique about Fitbit. We really think about, as a user, how can I provide you with a frictionless experience to help you reach those goals? How do I make that easy, fun, and effective? And that's really around providing tools, guidance, and inspiration.
Okay, so your users, who are your users? Give us like your demographics.
Wow, well, it's thrilling to say that we have almost 30 million active users, which is really impressive. So our users, as you can imagine, really represent the entire world and all sorts of demographics. We have products for kids. We have products that's really about a family story. So it's kids, it's parents, those who are busy, active lives, young professionals, and up into seniors. So I know my whole family, of course, is connected, and so I've got kids that are wearing devices, and I'm really focused on making sure they're healthy and active, but I'm also able to stay in touch with my aging parents and make sure that they're staying active as they age. And so it's really across the board, which is really exciting about living that mission of help everyone in the world live healthier lives.
Yeah, let's talk about the seniors. So your parents, do they give you access to their results, or do they want to hide that from you?
It kind of depends. No, I do. My parents are terrific, and sometimes I end up being tech support for them as well. But,
I bet.
But no, I think seniors is a really important demographic for us. There's a trend in the industry brought on and accelerated by the pandemic around healthy aging at home and being able to do that safely. And so how can a wearable who can be proactive and preventative around health, but still have that comfort of, I missed my doctor's appointment, or I wasn't able to go to that check-in for health and safety reasons, but I'm still able to actively monitor myself. And so you can also take that information and bring it to a physician if you need to, and if you're seeing a trend that is outside of your personalized range.
Okay, cool. So we talked about seniors. When we chatted 2 years ago, Fitbit was forming partnerships with health plans and other employers, sometimes just for the employees. So it's been 2 years since. Tell us about some of the progress you've made with health plans, employers, et cetera.
We're really pleased with the progress in this area, which we call Fitbit Health Solutions. And that's really, as you mentioned, working with employers, health plans, governments. It's ways that we can bring our consumer experience to populations. And how can we help drive population health? And so we've had a lot of progress in this area. We're working with many health plans in the US as well as internationally with governments. And we're working not only with their employees, but we're also really proud of the work that we're working with around both commercial, kind of commercial programs for employers, but then also our work in condition care management. And there's been lots of research that shows that when you integrate a Fitbit experience into a condition management program, by that I mean diabetes prevention programs, diabetes programs, hypertension. When you integrate that Fitbit experience, you're going to see a lift in engagement and results, and therefore better outcomes. So that's really exciting work for us, because we're all about having impact and impact on health, healthcare savings, and also health outcomes.
Okay, awesome. So you mentioned governments, international. So when you work with the government, what does that mean exactly?
Yeah, we're just thinking about programs. If you think about in the U.S., healthcare is driven largely by employers and health plans, but we also have governments in the U.S. who are responsible for many lives. So Medicare, Medicaid, the VA, who we are working, with all of those segments of the population. And then internationally, it's government-sponsored healthcare. So the way that we think about it is really around the payer. So who is responsible and is going to care about the long-term health of the individual and also of the population. And so our goal is, how can our devices and our services and those Fitbit experiences really help support care for that population, which again could be a country, and it could be a subpopulation like the VA.
Okay, so let's put that into reality. And what I mean by that is, how does your conversations with these payers, government, private insurance companies here in the US, how does that trickle down to the end user? Do they get, for example, a Fitbit covered by their health plan? Do they get reimbursed? Walk us through that.
That's exactly right. So they, as a user, as an individual, I might have access to a free or a subsidized Fitbit device, whether it's a tracker or our great smartwatches, more full-featured devices, to support my health. And it's a great way to have touch points of care outside of the four walls of the doctor's office. So you might see your doctor a few times a year, or maybe less last year. And so how can you make sure that you're supporting everyday health and really being proactive and preventative in your health? So you might have access to that, something that maybe you might not go out, you might, as an individual, might not be motivated to do that on your own, and you might need a little extra support. And so providing that as part of a preventative or a program. Let's say I was diagnosed with diabetes, and I might be at high risk for diabetes. The earlier on in a lifestyle, if we're talking about type 2 here, that you could that I could change some of my behaviors, my activity, my sleep, what I eat. I can have a marked impact on the progression of the disease or even reversing that disease. So the earlier on upstream, we can catch those and help with the lifestyle features that you could change to help impact your own personal outcomes is really impressive. It's about 70%, I think, of all chronic conditions have a lifestyle component to it that could be managed. So it's about bringing that, making it easier to access, making it very accessible, affordable, and engaging for them to have access to care.
So let's talk about that as we wrap up here. Engaging. So at the health conference here in Boston, where we're recording, a big part of what we're hearing at multiple discussions is about behavior being a large chunk of someone's health care or health. One of the things that frustrates me, and forgive me if I'm controversial here, audience, I believe that for those who choose and have the ability to choose to engage in good behavior should not have to pay as much for health care. Some people may disagree. If we have the ability to take care of ourselves, I believe there should be incentives to take care of ourselves. And I'm curious, I don't curious, I don't want you to have to give an opinion here, but has there been any incentives you've seen with health plans or employers to use Fitbit and to try to drive behavior to take care of one's health? Are you able to comment on that?
Sure. So I'd say one, it starts with access to care and access to the tools to support health. And so I think that's what's really important. And that's what's important around working with governments and other payers who are where incentives are aligned. There's a lot of talk at this conference, as you mentioned, around value-based care and moving into outcomes-based care. We believe that you need to first give everyone equal access and opportunity to healthcare. And then once you have access to healthcare, it's giving them the tools to help them live their best life or be their best selves. And a lot of that comes down to education and awareness. And that's a really powerful tool that Fitbit really thinks about is how do you drive behavior change with a health companion on your wrist? Someone who's always kind of looking out for you and thinking about and giving you insights around your activity and your sleep and how they work together, or why you might be having certain symptoms or behaviors. And so I believe that the best thing that we can do to help support healthier outcomes across the board is open up that access and have that access at the population level. And that really starts at the grassroots. Again, that comes back to some work that we do with the VA or with Medicaid or with Medicare, but other populations who might not have great access to care as some of us here.
Okay. And so does Fitbit, let's say the population does have access to it, and does Fitbit have the capability of showing leaderboards and things like that, or?
We do have leaderboards and encourage friendly competition. We all know that we work out harder or we're more accountable. And we know that who we surround ourselves with is so important to our health and healthy communities. Yeah. So we really do try to foster that. And we do provide, badges when you hit a first, I think I've circled the earth a few times, with my step count. So really trying to provide internal and intrinsic motivations, and then allowing you to share that extrinsically. So whether that's a competition or bragging rights to say you're at the top of the leaderboard, but various ways to help support your health long term, whether that's intrinsic or extrinsic motivation.
Okay, cool. And folks, you might hear some background noise. Just a friendly reminder, we are at the health conference in Boston. So let's finish with this. You've been with Fitbit for a while. Can you share about a time, and we have Lauren from PR with us, so I'll be cautious here. There's probably certain things you can't say. And thank you, Lauren, for helping coordinate your call, a lot of this today with Amy and others. What's a time in your Fitbit history where you're just like, this product was brutal, or wow, this was a waste of time? Are you able to share like anything like that?
Sure. Wow. You're going to go back into my early days of Fitbit. I've been with the brand and the company happily for almost 14 years. The first one, all joking aside, is we probably should have thought about the brand a little bit more. Everybody still capitalizes the B. It's F-I-T-B-I-T. The B is lowercase. And I spend a lot of time copy editing documents that still have the capital B, not from our team, but externally in the marketplace. So that's maybe something we should have thought about branding campaigns maybe earlier. That's a serious one. But on the product side, I think we in early iterations, and part of this is just the technology and the innovation catching up to the ideas, right? And we see that across all sorts of industries. But it was really about how do you take out some of the friction in literally wearables, something you want someone to wear all day, all night, all the time. And so some of our earlier products were clip-based products, which were great because they were very discreet. And we still have made some, and you have the opportunity to make them as a clip. But we found a lot of people really responded to the watch form factor because it was just natural, and it was kind of a natural replacement. We also used to, you'd have to tell the device that you were going to sleep. And we found it's much less friction now that we can automatically detect that you're about to go to sleep and when you're waking up. When you have to tell it to do that, it doesn't seem as smart, and it adds a layer of friction. So what we always look for is how do you remove friction from the experience and really just make it auto magic for the user.
Auto magic. Okay, awesome. All right, and lastly, the biggest win. You've been around 14 years. What would you say is a highlight for you? Something you look back on and it's like, I'm going to tell my grandkids, 30 years from now or whatever.
I am really proud of the impact that we have had on health at scale. When I joined as the fourth employee 14 years ago, the scale at which we've been able to impact people's lives and health is really insurmountable. Now, I think about that at a population level, but that's also at an individual level. So to have the opportunity and the pleasure of sitting at a conference where someone comes and hugs you because they said, you saved my parents' life because I was able to see this metric and we were able to get them help, and to be able to do that again at scale. We're doing that. Two things I'm particularly proud of. We're doing that for the VA right now, for caregivers, for veterans themselves, and for the staff. And so that has been incredibly meaningful to just be able to support them as we think about the pandemic and the support that we're able to provide. So and then the other one is seniors. So we talked about that a little bit earlier on in the podcast, but senior care, particularly over the last couple of years, has been really impacted. As we think about the impact of COVID-19 and the advent of telehealth, but which is promising, but not quite there yet.
Right.
And so our ability to be able to help seniors stay healthy at home by the use of proactive, preventative kind of health companions, that work is work I'm really proud of, and I think will continue on long into the future.
Awesome. Well, hey, Amy, great having you back again. Lastly, how do folks learn about Fitbit? Just the website, is that the best way to?
Yeah, you can find us at Fitbit.com and hopefully in lots of your friends and family as well. And we'd love for you to come and check us out. We have had a lot of innovation in the last couple of years.
Amy McDonough has been our guest, a leader at Fitbit. And Amy, your title is long, so can you help remind the audience your role there at Fitbit as we close out today? Absolutely.
Thanks again for having me. So I lead our health solutions business. So I'm the managing director and general manager of Fitbit Health Solutions.
All right, very good. Well, thank you so much. And Lauren, thanks for joining as well and helping coordinate a lot of stuff here at Health. Thanks a lot.
Thank you. Stay safe and healthy.
Thanks everyone for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com. iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.